Part of the reason why we started testing street drugs is because we don't find out what's in the drug supply until it's too late, when people are either dead or they're arrested. There's no opportunity for prevention, there's no opportunity for recovery. We can do better. My name is Nabarun Dasgupta. I'm a senior scientist at the University of North Carolina in Chapel Hill. Every morning, we come into the lab and there's a dozen packages from around the country waiting for us. Those packages contain the drug samples that have been sent to us for analysis. We do some basic steps to clean up the drug sample so it's ready to load onto our instrument. What this very fancy machine does is figures out exactly what's in that drug sample down to the atomic level. And we're able to put those results out, both back to the individual and the groups that send us the samples, but also aggregate the data so that we can see trends across our state and really across the country. Our fundamental mission is to make our neighbors healthier. We want people to make better decisions about what they put in their bodies. Science can help with that. Our goal is really science in service. We serve over 160 programs in 43 states. What we are doing here on campus has repercussions all over the country.
Trends observed by the lab have helped us understand that we need to intensify our work because the amount of people who are dying or being impacted by overdose is still too high. My name is Charlton Roberson, and I'm the Eastern Regional Coordinator for the North Carolina Harm Reduction Coalition. The North Carolina Harm Reduction Coalition is a grassroots organization in North Carolina that provides life-saving services to individuals who are impacted by substance abuse.
Organizations like Charlton's are absolutely essential because they are the last mile. They are the ones who have direct connection to the communities they live in, the communities they serve. As the overdose crisis ramped up in the United States over the last few years, we were faced with a second crisis, which was that the antidote itself was getting to be too expensive and too subject to the whims of the supply chain, and there were shortages. We set about to fix this. We created a nonprofit to provide bulk naloxone distribution to frontline public health programs with very low overhead and very rapidly. This allows programs to have access to enough of the antidote to actually make a difference in the overdose death rates in their communities.
Nab and his crew at Remedy Alliance have been very, very useful to us and impactful for us in providing us with Narcan, but also other things like xylazine and fentanyl testing strips that we can pass out to individuals and canisters of oxygen.
We still have a long way to go. We're still losing way too many people we love in North Carolina. And I think with the tools that our lab and our community partners bring to the table, we're changing what's happening on the ground here.